If you are considering having facial rejuvenation surgery, such as an eyelid lift, face and neck lift, or forehead lift, you're going to be very concerned about your recovery. So let me tell you a little bit about what it's like. After you've had your procedure in our clinic, you may go home the same day if you've had an eyelid lift. But if you've had a forehead lift or you've had a face and neck lift, usually we keep you overnight one night with 2 nurses at your care to make sure that you have the smoothest and quickest recovery possible. During the early periods of time in facial rejuvenation surgery, we like to keep your head elevated, and we have you use some cool compresses to keep down the swelling. Virtually everybody gets a little bit of bruising and swelling, and some people can get quite a bit. The good news, bruising and swelling really don't cause any pain, but you may look pretty nasty. Most patients find that there's not very much pain with this type of surgery, and I want to stress that. Certainly with a face and neck lift, you have a feeling of tightness in the neck, but this will go away. With eyelid surgery, virtually no pain whatsoever. Patients having a forehead lift can have a headache, and sometimes their stomachs can be upset for the first 12 hours or so, but that usually settles down pretty quickly as well. Our patients all go home that very first morning, even if they spent the night in our clinic, and then we see them back, or see you back, on day 4. At that time, we take out upper eyelid and lower eyelid sutures, and we take out some of the sutures related to a facelift. We see you back again on day 6, and at that time, take out the remaining sutures, and sometimes in the forehead lift, there are some staples. By this period of time, the bruising and swelling is starting to settle a little bit, although you still don't look really good. Most patients, by 2 weeks, become sociable. That doesn't mean that all of your swelling is gone or that you don't have a little bit of yellowing here or there lower down in the neck. But by and large, over 90% of our patients at 2 weeks can get back to normal social and normal professional activities. It can take up to 6 weeks to get about 70% of the healing taking place. And that means a little bit of lumpy bumpiness and redness in the incisions is continuing to settle down. And the final result, that can take 6 months to a year for the incisions to become just fine and smooth and light-colored, for your skin to have all of its sensation back completely, and to have everything just as smooth and looking as nice and natural as you would like to have it. So, in summary, 2 weeks back to all of your usual activities, but a little bit longer to get the very best result.